we've got an entire lecture for you guys on Morpheus. So just know that Optimus has Morpheus, but we're going to really do Morpheus well later on in this weekend and give it its own space. But the Optimus does have Morpheus on it. We're going to really allocate time tomorrow at 9 a.m. for the Morpheus. And I'm going to do a demo. I'm going to do all kinds of stuff. And so we're going to kind of blast through that. We'll just show you, if you're new to the Morpheus game, most of you are not, the type of correction that you can create with Morpheus. This is my team around a pesky belly button for a very fit mom of 2. I actually think she had twins, come to think of it. And so she doesn't have any fat reduction needed. She just has texture and skin laxity around her belly button, which is a common problem. We created change for her with just utilizing Morpheus. Feel free to take a picture so you guys can get to the settings, and we'll get to those, all the settings and the theory behind the settings tomorrow. There's more work to do on this, but again, this is just after 1, but look at the change in the banana roll in the reduction, and this is using your Morpheus Deep on a body area on a fuller banana roll, utilizing the burst. Again, we'll get to what all that means tomorrow. This one's kind of crazy. Until I set it up, it doesn't look that impressive, and it looks even more impressive on a better screen. But this patient, usually when we're doing Morpheus on legs, meaning circumferential legs, fronts, backs, all the way around, usually we have to, either because of lidocaine maxes or patient tolerance, we kind of split it up to make it easier, bite-sized chunks. And it's very easy to do front half and back half. I mean, that just makes sense. You're laying there. One day we'll just do the whole front half, and then next time we'll come face down, do the whole back half. But for your guys' benefit, I did top half, bottom half. Just so you can see, I did a circumferential top half, and then went back and did a circumferential bottom half. So when you see that, look, you can literally make out a line of demarcation, okay? So this patient was treated 1 time circumferentially in the top half of her, with Morpheus Deep, and today she was coming back in to treat the bottom half. Can you guys see that line of demarcation now? Isn't that crazy? So top half was done. This is the picture right before we went on and did the bottom half. And then this is combo treatments with the Evolve plus Morpheus8. Under eyes with Morpheus. And we'll, again, talk through all the theory. Festoons that were treated. So when it comes to treating festoons, make sure we understand these are not eyelid bags. This is not pseudoherniation of periorbital fat that creates an eyelid bag. This is malar edema, and the two are totally different. Look where this lives on this lady. This is not an eyelid bag. This is on her malar eminence. This is chronic subdermal lymphatic edema. It's got a genetic predisposition. It's got an allergic component, and so they get chronic swelling. The best way to treat these is to shrivel up, dry up the lymphatics. The way we do that is use our Morpheus. Shrivels up the lymphatics, creating this amount of correction. This is not an eyelid bag, so if you're taking pictures, the treatments are much, much, much more robust on this. The eyelid would not tolerate these settings. So you're not on the eyelid, you're actually on the cheek with this. And that's indicated by this purple line is the area that we treated. Here's a local cardiothoracic surgeon that didn't have time for surgery. What's the next best thing you got? It was Morpheus for this skin, this heavy skin on his malar eminence. Now this is pseudoherniation of fat around the eyeball. Okay, that is pseudoherniation of fat. And so we treat a little bit differently, but look at what we can do. Now we're not melting fat, hear me clearly. If there's any oculoplastics in the room, they're gonna have a heyday. I'm with you. We're not melting fat. What we are doing is tightening preseptal components. So we're tightening orbiculaires. We may be getting to septum and tightening septum. So think of it more like if an old man has a beer gut and we're just tightening up his belt, ratcheting up the belt, holding the fat at bay. So that's what we're doing with our Morpheus with pseudoherniation.